All right, well, very good. Well, hey, everybody, thank you so much for the invitation, Dylan. Um, and again, just thank you for the opportunity. Dylan and I met while he was doing his doctoral work at Indiana State. My background, I am an athlete trainer and have been so, you can tell from the gray hair, for a number of years. So I have done a variety of things, all the way from starting outreach programs for hospitals and physician practices to starting my own rehab practice, partners with a physical therapist, and did that for years, ended up selling that practice to a hospital system. And I was vice president of a hospital system and ran all of the rehabilitation and occupational health, orthopedics and neurology for 4 did that for a few years. The last few years, I have started my own business, Clark Group Associates, and see if we can move it forward. Okay. There we go. Through Clark Group Associates have done a variety of things. One of the things that I'm not sure you as students would have with you coming in, but Dylan may remember that I worked for the NATA for a number of years. I was the first certified athletic trainer to ever actually be on staff at the NATA office. And I actually did my work out of Indiana and was just connected with the office. And I was the director of strategic business development for the NATA. During that time, then I started the third-party reimbursement pilot with the NATA, which has morphed into the third-party reimbursement initiative. Joe Green that over, and he and his group are doing a fantastic job with that. I'm also currently the project manager for the Indiana Athletic Trainers Association and handling strategic business development, with them. So Clark Group Associates is, I do consulting in the sports medicine athletic training space. So everything from, as I mentioned, with the NATA, consultant with the American Massage Therapy Association, many different universities, across there, locally in Indiana with Butler and Purdue, but out in Minnesota, I've done it in Texas, Clemson, et cetera, in different aspects. The business of athletic training, really, and that is my specialty in what I do. And I think that's the reason that Dylan has brought me on board. I really want this to be, for you guys to do this. I've got a bunch of information to kind of put out there, but I'm very interested. We'll kind of go through it, and hopefully we'll have plenty of time at the end to ask any questions that may have come up in your mind during this presentation or that sort of thing. It is important for you all to know that while we're talking about business, that really the purpose is about affecting and improving the healthcare of our clients, our student athletes, any clients we might have, industrial athletes, if we're working in a clinical or physician practice. We don't always think about the business or the money side of affecting and improving healthcare. But as I've often said to people, no money, no mission. So if we're not being compensated, if we're not taking care of the business, and that includes the operations of such, then that affects the quality of the healthcare of what we're able to provide. So this presentation on business really does affect that. We're going to talk about these things that I've got listed down there, and we'll kind of get into that. And that's what all we're going to kind of cover in the hour or so that we've got here. So what different ways can you guys get paid? What compensation can you get? Well, really, there are three main ways that you as an athletic trainer or myself as an athletic trainer gets compensated. It's either through cash, through contract, or being reimbursed by a third-party payer. And as far as athletic training compensation, there are really two main questions. And these are questions that when I was the National Manager of Strategic Business Development for the NATA, and in that role, I took calls from athletic trainers, members from every state. I represented 45,000 athletic trainers. So anybody that had a billing, coding, reimbursement, business strategy question, that was directed to my office. And a lot of those questions, when somebody would call me about something, it came down to two things: what's legal, and then what's business. We always have to answer the legal question first, no matter where you're at, what state. You need to understand what your Practice Act and what you can legally do, not only with your license, but your scope of practice. What are you trained to do? I can tell you, you guys as students, your scope of practice is probably broader than mine, because when I went through, I didn't do anything with casting. I didn't do anything with reduction of dislocations. I did not do anything with suturing and that sort of thing. And so I know that those are routine things that are being taught in athletic training curriculum programs now. That's not within my scope of practice, but it may be in yours. And if you've got that documented, you have that training, fine. If I went and did that, it would not be legal. Then we come down to the business aspect. So we've answered the question. It's legal to do it. Now we have to answer, well, will anybody pay you for doing that? And that's true. You know, we're athletic trainers and we're talking about getting paid as an athletic trainer. But if you think about that from a business aspect, that's true with any business. So you're opening up a restaurant. Is it going to have the quality, the type of food, the service, the pricing aspects that makes it valuable for somebody to want to be able to utilize that and to do that? So any business has to answer that question. Do you have the value that people consider to be able to utilize you? These are things that you guys know just to put up, but here are kind of the different athletic training employment opportunities. What I want to point out, college, university, you're going to get paid via contract with that. Higher education, contract. Professional sports, most likely contract. Secondary school, that's going to be a contract. Healthcare, admin, or rehab. Could be contract. Usually it's going to be contract. Hardly any cash. There are some occasions that I run across, or maybe third-party reimbursement. Military, that's going to be a contract. Occupational health, contract. Performing arts, usually it's going to be contract, could be cash. Physician practice, almost always a contract. Private athletic training practice, all three. So cash, contract, and third-party reimbursement, and then public safety contract. So I wanted to go through that exercise a little bit for you to understand that. And when we're talking about, you know, contracts, and I'll get into that, what that amounts to, and you understand why we're there. Well, let's start off with cash. Hey, you've heard this before. Cash is king. Cash is, if you can get paid with cash in whatever way, that is always best. That's the best way to get that. Payment is direct from the client and patient. You're not having to bill for it. You know, you've got money in your pocket right away. You do not have the overhead of collecting and trying to run that down as you would in insurance. It's immediate compensation. And if you know anything about insurance, it's weeks and usually months before you would actually get paid for that. So we kind of looked at all the different ways that that you guys could be working in the different areas to do that. If you're in a cash situation, and usually that's the biggest of that is going to be private practice. That is really up and coming. I have currently 5 private practice groups that I consult with around the country. Florida, Texas, California, and Indiana, that are all cash-based models, that are all athletic trainer-centric models. One is concussion navigation, One is doing wellness, rehab, and covering secondary schools as an athletic trainer. One is in Florida, working with tennis academies and as well as CrossFit groups, doing rehab and performance. And then my practice in Indiana is doing industrial contracts, is doing private practice work, and is doing contracts with schools for providing coverage. So cash or contract based, none of those are insurance based. You're really only limited by your imagination. If you are an entrepreneur and down the road would decide to do this either on the side as a part-time business or full-time, and I'll tell you that the groups, my 3 practices or my 4 practices, 3 of them are full-time. The athletic trainers, this is how they're making a living. The 4th, it's a side hustle and doing that. These are all the different things that, and you're only limited by your imagination, you can do. How do you set your fees if you're going to do cash, right? So what am I worth? I'm sure that you've heard plenty about the worth value model, et cetera, that is in the ATA. It's discussed in, state, district, national meetings and all that. But what is your value? What are you worth? If you're asking somebody to pay you, what does that amount to? Here are 3 different methodologies. We want to make sure you're covering your cost. So what is your cost? Time, materials, overhead, expenses, and whatever you want to make as a profit. That is the cost. There is the RBRBS system. That's really a government system that Medicare does a rating. And that's how all the Medicare rates are set. And so that is a good methodology to at least look at. And they've rated anything from therapeutic exercise, gait training, any modalities, aquatic therapy, etc. Those are all rated by Medicare. And what they say, they set a rate on that. You could take that as a basis and then be able to determine really kind of what you should be doing. And then use another fee schedule. What is true in your market? So you're living, you guys are in Utah right now. So what are massage therapists making in Utah? I will tell you that probably the routine is about $1 a minute. So it's going to be about $60 an hour. You'll have some rates will be cut off of that, but quite often it's going to be above 60. When I was doing the consulting with the American Massage Therapy Association, the average was about $75 to $80 an hour on doing that. Would you guys take $75 to $80 an hour, 40 hours a week? I would say yes, I would to do that. So what are you paying the HVAC? If you own a home or et cetera, and getting the air conditioning, heating taken care of, what is that business? They're making $75, $80, maybe $100 an hour. You take your car into an auto mechanic, what are they making per hour to do that? So I say all that to you guys because we need to realize as athletic trainers, the education, the time we're putting in, the responsibility that's on us is at least as much or more than these individuals. We should be getting paid appropriately. And if you spend any time on any social media and all of that, I'm sure Dylan has, the big thing is, hey, we're not getting paid enough. So, the whole compensation. So until we understand this and put our foot down, we're not going to. I want to talk to you a little bit about selling, and selling or sales is something that is kind of overdone. A lot of people don't like even talking about it. We don't tend to really want to think about ourselves as salespeople, right? I don't. When I owned my rehab practice, I hated the thought as I was going around visiting physician practices and all that sort of thing, that I was a salesman trying to sell them. I really took the mindset even in those days, that, hey, I've got great services to provide for your clients. I'm just informing you about those, letting you know how to get them. And it's up to you to decide whether you want to take advantage of it or not. I'm not trying to sell you anything. You either need it or you don't. Now, that is sales, but I really never thought of myself as a salesman, and I still don't. And I don't think that you should either. You have a skill set, et cetera. It's about developing a relationship with people. So that's something I really want you to understand as we're talking about this. It is about developing relationships, and you're in quote unquote sales, no matter what job you guys do as you get out of school, whether you're going to be a secondary school athletic trainer, college, university, work in a physician practice, private practice, a rehab clinic, military, performing arts, whatever the case may be, you are going to have to sell yourself. It's just developing a relationship. And we're going to talk about that a little bit more here in a little bit. But you need to do that. You need to understand your client. What do they want? What are their needs? If you can provide solutions to their wants and needs, then they're going to want your product. If they do not have wants or needs for what you're selling, our athletic training services, then they're not going to buy. And that's good. Then we know and move on. So it really is about nurturing relationships and being able to do that. In order to get, you've got to give. Athletic trainers are great about giving. Okay, so that's second nature for athletic trainers in doing that. Networking is so important, and the thing is that networking doesn't happen. You don't just show up someplace and everything happens accidentally. You need to network purposefully. Who do you want to get to know? Target people. If it's in a business situation, if you're a secondary school, you want to get to know, obviously, the coaches, the athletic director, the principal, maybe even board members, key parents. That's networking. That's developing relationships. And you should go about it intentionally, not just, hey, hanging out the athletic trainer and whoever comes in, you're going to develop a relationship with. You need to be intentional about developing relationships. I kind of have added this: appealing to everybody ensures you appeal to nobody. Know who you are, be confident in who you are, what you provide, what you're about, and be that. Do not try to be all to everybody. Do not try to be friends with everybody. And that's true whether it's our student athletes or from a business aspect. Be who you are, what you should be, with honesty, integrity, and hard work. That's either going to appeal to the right people, and I would say that that's the people you want to appeal to. If it doesn't appeal to them, then fine. Move on to the ones that do. So we didn't really get to know each other, and I have no idea where you guys are at in the dating game. But client-focused selling is very much like dating. Okay. If you see someone who is interesting, you may go to class with him. You see him out and about, whatever the case may be. Pre-contact planning. Now, again, I'm a little bit old school, so this definitely applies. Maybe you guys in the new school of dating, this doesn't apply. But I still think it does, because I think it's human nature. If you see somebody that you want to get to know, you're going to figure out, well, how can I bump into them? How can I make that contact? What is the initial contact? Okay. Again, calling, email, personal, whatever the case may be, you're going to be doing that. Meeting or the date. That's the interview, right? If you do in a dating relationship, if you do all the talking and telling your date how wonderful you are and all the great things about you and what you're going to do and etc. like that, and do not learn about your date and what they're about, what they're interested in, what their wants and desires are, etc., I can tell you it'll probably be your last date. The same is true with developing a relationship with people. Okay, selling, if you will, it's not about you, it's about them. It's finding out about them. What's going on with them? What is their world like? Some of the things that I do in dealing with insurance executives or healthcare executives is what's keeping them up at night, right? What in the insurance world and with the pandemic that we have all been living through in the last couple of years, what I know how it's affecting me, but how is it affecting you? What's going on? Through all this process, you're kind of qualifying the prospect. Again, think dating. You know, there's a connection or not. You know, my wants and needs and what I have, you know, kind of meshes up with their wants and needs. And so there's an opportunity of coming together and qualifying them. The natural close is developing the relationship, getting to know them, talking things through, understanding that. And, you know, the last is the proposal, closing the deal, if you will, in selling. And again, a term that I really hate, and which is why I really want you to think about it as dating. And again, I don't know whether any of you are married, whether you're dating, engaged, or wherever that's at. But if you're not, okay, if it gets down to and you're ready to propose, I would challenge you that you really want to have a pretty good idea and feel of what the answer is going to be before you propose. And the same thing is true in a relationship as you're developing that and getting to know people is you want to have had several opportunities to meet and discuss and understand who they are and they understand who you are. And if you propose a plan, a proposal, of, you know, whatever the case may be, you want to have a pretty good feeling that, hey, they like you, they like what you're doing, they like the service you got, and they're going to buy. So that's kind of selling, and that is true across the board. And I kind of thrown this into from the business aspect because really relationship development, which we call selling, is so important in all aspects of what we do. So contracts, you know, as when we looked at our board, you know, the 80% of what we're going to be employed as or doing involve contracts, either as an employee. So you essentially have a contract if you're at a secondary school or college university. Dylan has a contract, you know, in teaching there. That's how he gets paid. He may not think of it as a contract, okay, but it is a contract. There are corporate contracts. So when I was running occupational and industrial programs, I had a contract with SuperValue, Subaru, International Harvester, etc. People, corporations I worked with. These were the services that we were going to provide. We had a contract and agreed upon how we're going to get paid in doing that. So there's those type of contracts. So what do you do with a contract? You just take the first thing that, you know, you're applying for a job, they throw out, hey, we're going to pay you $12,000 a year, no benefits, et cetera. And you just say, well, I guess that's the best I can do. And that's what you take. Hopefully not. And I throw out $12,000 a year. Guys, when I started out, $12,000 a year is what I started out at. So hopefully you're going to start out much higher than that. But understand your worth, and that also understands the market. What are people making? Kind of going back to even what we talked about, you know, earlier of, first of all, other athletic trainers in the area, even physical therapists and healthcare providers, what are they making? Massage therapists, et cetera. Massage therapists in Utah are going to get paid differently than they are in Los Angeles or New York or Seattle. Know your market, you know, with that, and negotiate. It is okay to negotiate, even in a secondary school contract or college, university, or whatever. Know you can negotiate, and don't be afraid to walk away. So how do you negotiate? what does this negotiation look like? This is important for you guys. These are some of the kind of the soft skills that people, ask me about. And unfortunately, a lot of people don't understand or feel comfortable in doing that because it's a little confrontational, right? To be able to do that. Somebody's offering you something and you're going to say, you start asking questions. Well, again, I kind of talked about this earlier, what are the ATs being paid for like work in your area? Understand that. If you're being lowballed, understand. If you do not know this, you have no idea whether you've been offered a good contract or a lowball contract. So you need to understand this for your own good. As I said, physical therapists, massage therapists, healthcare professionals, or other professions. This basically goes to the economy of the area where you're at. I mean, if you're in the Appalachian and, going through Kentucky or Arkansas or North Carolina, et cetera, rural, the economy is going to be a whole lot different there than, as we said, in a major metropolitan area or et cetera. You have to understand that. So you can't just look at the NATA job ratings and take that as gospel. That's giving an average, for national things or maybe even major district geographic areas. Make sure that you understand your position responsibilities up front. Sometimes getting your first job, you're just so excited to get that and you're offered that you really don't, your expectations and the expectations of that AD or that rehab director or that physician, they may not be the same, right? Understand the responsibilities up front to do that. It's okay to ask, what is the salary range for this position? Any HR, small company, big company. Smaller companies sometimes are not going to have as much, but there should always be a salary range for an athletic trainer, entry level up to highly experienced. And that range could be $10,000, $12,000 difference from beginning to end. If you get offered something and you've got, a master's degree, you've got specific training, maybe some other background, education, et cetera, and they're offering you right entry level stuff, part of the negotiation going, well, here, I've got this background and all of that's really going to benefit the company. And they can maybe move you up more toward middle of the range. Negotiation. Benefits. Sometimes benefits is easier to negotiate than dollars. You get offered something and they start off with no benefits. We're not going to give you anything. Health insurance, life insurance, those type of things, paid leave type of things. That is important. It may not seem as important today as it does as you get older. You have a family, you have children, et cetera. And those benefits mean a whole lot more, but benefits add, about 28% on top of the salary. So if you get offered by a hospital $50,000 a year, it's actually costing them probably $62,000 to $63,000 a year because of the benefits, of the cost of benefits on top of it. So you need to understand that. But sometimes, because of their benefit packages, adding one more to this doesn't add any more cost to that, but it certainly makes a big difference to you. Understand that. The other thing, gosh, guys, be professional, be confident. And to me, you could be confident when you have done your homework, when you understand the market, you understand all the things that I've talked about before, and be firm, not nasty, but don't take this personally. You are negotiating for yourself, for your family, for the future, but it is business. That's how they're taking it. You take it as business, don't take it personally. And have a feeling when you should walk. I mean, if somebody just is really lowballing you and et cetera, only you can weigh out the options of where you're at. If you do not know where your next meal is coming, You got to pay the bills and that sort of thing. There are times that you just got to take that's as high as they're going to get. And you have to take what you got and work your way up. I understand that. I've been there. When I moved from Illinois to Indiana with a family and 3 kids and et cetera, I took a 10% pay cut to move from one hospital system to another because I saw opportunity. A lot of people thought I was absolutely nuts. It turned out to be extremely good in doing that, moving from kind of a more rural area to the Indianapolis area, a lot more opportunity in the sports medicine, athletic training aspect, and to do that. And so my salary soon climbed very quickly. So I had to take a step back to be able to then be able to move forward. That's part of your analysis. That's part of what you need to understand. Just a little something in here. Edward Deming, if you get a chance, look up Deming. Very famous back from a World War II aspect on efficiencies and et cetera. But one of the comments that he made that I really do like is, we do not have to change because staying in business is not mandatory. I utilize this a lot with athletic trainers in the third-party reimbursement aspect, and for athletic trainers, maybe more old school. You guys are not there, so it doesn't mean as much. But basically what we're looking at is, we really don't have to change. You don't have to change your attitude in doing that. But hey, nobody cares, right? Because staying in business is not mandatory. You getting a meal, you paying your bills is not mandatory for somebody else. You've got to take care of that. So you have to decide what you got to do and when to be able to change. So we've talked about cash. We've talked about contracts. Now I'd like to kind of jump into third-party reimbursement. Just to get a touch on that, Dylan said that you guys have had some aspect of that. I'm going to kind of fly through this because I definitely want to leave us plenty of time because there's a lot of things that we could talk about in third-party reimbursement. But this is a third-party reimbursement initiative. It basically is about getting insurance payers to pay athletic trainers autonomously. In other words, we're not billing through the physician. We're sending out a bill as an athletic trainer, same as a PT, as an OT, as the physician. We're sending out and being paid as an athletic trainer autonomously, the same as other healthcare professionals. This is something just that you need to understand. I put this slide in from work that I did with NATA because when I started working at the NATA office and they said, we want you to really help us with a third-party reimbursement initiative, they didn't understand the third-party reimbursement. These are all different categories. These are all different insurance aspects. These are all third-party payers, but I tell you that they're all different. They have different marketing strategies. They have different rules and regulations. And one third-party payer is not the same as another. And so you just need to know that. Billing 101, these are just some of the things that if you're in a situation to do billing, and I might say, well, what would that be? If you're in a health system, there may be an opportunity in a lot of different states. Working for a private practice rehab group, there's a possibility of billing. Those are the two main. There are some college universities that are doing that, and I'm going to talk briefly about that later. But the main places are going to be large systems, health systems, or large rehab practices to do that. I would not recommend any athletic trainer going out to put their shingle up to do a practice and say that they're going to bill insurance. The costs, the infrastructure is just prohibitive to do that. So billing third-party reimbursement is important because it's about recognition, but it's not from a practical standpoint where a lot of athletic trainers are going to be. Here are all the things that you could see. Dylan's got copies of this. These are all the things that you need to consider and that you know. Some of we talked about, you really need to know your practice act and what you can and can't do and those sort of things. You need to have professional liability insurance. And that's true. When you work for somebody, if it's college, university, secondary school, hospital, make sure and ask them. You may assume that they've got professional liability insurance on you, but I've heard horror stories of secondary school athlete trainers that they thought they were covered by the school systems. And when the insurance liability people found out about athlete trainers, what they did, they really found out that they were not covering athlete trainers. So make sure that you've got that. You may want to carry your own professional liability insurance yourself. And again, the NATA has got great services and recommendation on that. If you're doing billing, there are different billing systems, forms, and et cetera that you need to understand that will go in that. In NPI, you need to have your NPI. Hopefully you guys have got that. Hopefully, that's something that as students, you've applied and gotten that. And then once you graduate or certified, then you would change that NPI to a professional level. Fee schedule, we've talked about pricing. I'm not going to talk about that anymore. If you're doing third-party billing in your state, is it being done? Is it recognized? Is that's something that is recognized in your state? Indiana is one of the top states in the country being recognized for third-party reimbursement. Indiana, Wisconsin, Georgia, Vermont, Missouri is coming into that. Michigan is really starting to do that. But if you're doing this in Utah, is anybody else doing third-party reimbursement as an athletic trainer autonomously? I'm not aware if they are, but they could be. Understand that. Call your association and find out. So what are the benefits to third-party billing? Number one thing, and the reason I've got it listed, is recognition. If you're recognized as a healthcare professional that is recognized by insurance companies to receive payment, that puts us on the even playing field with other healthcare professionals. Recognition. I will tell you that PT, OT, physicians, everybody else are trying to get out of third-party billing. They hate insurance. And so they're going to concierge services, they're going to cash models as fast and as often as they can. So we need to understand that. But there is a reason for us to be able to fight that. It's a new revenue stream for athletic trainers. And again, I think in those places within health systems, large rehab practices, physician practices, that's where we could see that. It does increase our visibility and referrals. So what are the drawbacks? Well, you're going to see there are more drawbacks to the third-party billing than there are advantages. Increased administration, all of these things, documentation, pre-authorization. It's a paperwork overload. And I would be willing to guess that anybody listening to this is not a fan of paperwork. If you are, you're not like any athletic trainer or healthcare provider that I know. Increased regulations. If you're going to do third-party billing or reimbursement, you got to deal with co-pays, co-insurance, deductibles, state laws, insurance fraud. There's so much to be considered in that's involved that you don't have to worry about if you're doing cash, operating under your license and your scope of practice. Increased infrastructure. As I say, higher cost here. You have to have a system. You have to have a billing system that's going out. You have to be able to chase that money. The earliest you're going to get it is 3 to 4 weeks, and more likely it's going to be like 6 to 8 weeks to get that money. So you provided a service back here that the patient or the client has already gotten, but you're not going to get paid for it for 2 months. Doesn't seem fair, does it? That's why cash is king. It's much better to do that. Reimbursement rates continue to decrease. Medicare keeps going down. That's why every healthcare provider really is trying to get out of this. I want to touch on the collegiate setting because this is something that I've done a lot of consulting with and to to work on. There are universities across the country. This was a real hot topic probably 3 to 4 years ago. I know there are some universities that are still doing this. And I've done consulting with a lot of them across the country. These are all considerations that when you walk into a university that you need to consider if you're even thinking about doing this. You know, what are the policies for your student athletes? You know, is this a D1 school, D2, D3, NAIA, private school, whatever the case may be? What is your policy? D1 athletes, you know, above 95% of student athletes in D1 schools have their injuries paid for and taken care of by the school if they're a student athlete. You go to D2, that percentage goes down, you know, into the 70s. D3, they don't pay for them. It's what I call the high school model. So I, as a parent, if my child is playing soccer or football or swimming or whatever, and they get hurt, it's on my insurance, not the school. So understand that. What are you going to bill? Who are you going to bill it underneath? What are the documentation standards for the insurance, etc.? What are you going to bill for? Okay, you're going to bill for physicals. You're going to bill for actually rehab. You're going to bill for taping, et cetera, et cetera. What is it you're going to bill for? You need to determine that. And if you are interested, if you're at a school and you get asked, you guys graduate and you're at a university and the AD goes to a conference and hears about, hey, we can be billing for this. And they come back and say, make this happen. Okay, well, all the considerations that I've kind of thrown out there, one to understand, but there are other, they're only interested in the revenue, right? And so there are partnership opportunities. I put Select Medical as one of those. Select Medical has many relationships with college universities. Villanova is one of those where they actually have a contract with Villanova. They provide athletic training FTEs and et cetera. And there's a relationship where Select Medical makes money, but they're also paying for utilization of Villanova athletic training sports medicine space. So there is some money and some FTs actually coming to Villanova. Select Medical has access to the student athletes and they're doing the billing and collection themselves. Same type of partnership opportunities with local orthopedic or sports medicine groups. I work with University of Denver. They were really working on this through the consulting aspect that I did with them, and there was great opportunity for that. Love John Wooden, love so much of the things that he says. Failure is not fatal, but failure to change might be. So we should never be concerned about failing because we're all going to fail. If you're not failing, you're not trying. But if you don't change, you know, then that's going to be a problem. CAQH, just so hopefully that would be a term that if you've not heard, Council for Affordable Quality Healthcare. You guys would probably never believe this, but back in 2000, 2001, prior to that, all of the contracts, if a physician or a health system wanted to be a preferred provider with any of the insurance policies, et cetera, they had to fill everything out by paperwork. And that paperwork was about 20 pages long. And so if you were a physician's office and wanted to be a preferred provider for 10 insurance policies or companies, you had to do that 10 times and all that. To make things more efficient back in 2000, all the insurance companies, health systems came together and they developed an online system called CAQH. It's a system that collects all this information. And then if Blue Cross Blue Shield wants to see that information with a click of the button, they can get the information that you filled out. Everybody utilizes CAQH at this point in time. Why that's important for you as an athletic trainer to know is that up until 2015, athletic trainers were not included as a recognized healthcare provider by CAQH. On this date, ProView, they updated it. I know because I was working with the NATA then, and this was a project that I worked on with CAQH to make that happen. So one of those proud moments that I was involved with to get athletic trainers recognized in that. NPI is important. It's recognition. You know, if you've got your NPI, and I hope you guys all do, that is a federally recognized number. Only individuals who are recognized as qualified healthcare providers can get an NPI. That is per the government. So that's why every athletic trainer, whether you're doing billing, whatever, should have an NPI, because that's a federal recognition that we are a healthcare professional. So with that, that's a soapbox that I could get on with that. International Classification of Disease, or ICD-10, used to be ICD-9. You guys would know it as 10 since it's been out for a while. These are classification of diseases. I bring this up because as athletic trainers, we cannot determine, we cannot diagnose and put that ICD-10 diagnosis down as an athletic trainer. Now, we may know it every bit as well as anybody, but you know, the physician, chiropractor, DO, whoever, they're the ones that officially make that. And if you're doing billing, et cetera, it needs to come from them. You may be the one that recommends to the doctor, you know, what they should do, but it comes from them. That it's a legal thing that we need to understand. CPT codes, however, are things, those are the actual procedures and services we do. I'm sure that you guys have touched on CPT codes. What is important that you definitely need to understand is CPT codes are owned by the AMA, American Medical Association, not by Medicare, not by any insurance companies, not by anything else. AMA are the ones that own, run, and regulate CPT codes. I served on the healthcare provider network with the AMA for, I don't know, I guess 4 or 5 years in consulting on these. If you look at a CPT code book, which is about this thick, this group wordsmiths every word in that document. It's one of the most tedious. If you want to go to a boring meeting, that's about as boring as you can get. You think Dylan is boring? This one will really get you. So CPT codes, important to understand, you know, what they are. With denials, you know, through this, everybody gets denials, AT, PT, physicians, whatever. Understand why you get denials. Don't take it personally if, as an athletic trainer, you're getting that. Understand why there are, then be able to go back and try to respond back to that. I'm a former baseball player. I played baseball at the University of Illinois. So you know, I love baseball quotes. Babe Ruth, never let the fear of striking out get in your way. You may know Babe Ruth, you know, 714 home runs. What you may not know is that he struck out 1,330 times. So he struck out twice as many times as he hit home runs. If he gave up every time that he struck out, he would never hit the home run. So you can't give up, keep pushing forward, move on that. Here are some references. Again, Dylan has got copies of all of this for you guys to have. And Dylan, you can certainly make copies of this to back up the information that I've given to you. Finally, again, Schwarzkopf, General Norman Schwarzkopf, leadership is a potent combination of strategy and character, but if you must be without one, be without the strategy. Now, I can tell you Schwarzkopf was a major strategist, so he was always with strategy, but that tells you what is important about our character, is important about us and what we need to do.